2014 budget will please come back to order. And for our next segment, I would bring to everybody's attention that as a result of the reorganization of the Health and Human Services Department, that the Child Support Enforcement Agency was placed under Employment and Family Services. And so in this next section, we're going to have Employment and Family Services, but we're going to have two presentations. We're going to have Jacqueline Ward and Russ Kay will be presenting on behalf of both agencies, and if it's okay with everybody, we're going to hear the two presentations, and then after the two presentations, then we'll continue with questions in both areas. So we'll have Jacqueline Ward is presenting on Employment and Family Services. Is that correct, Director? Yes. We will start with that presentation. Please come forward.
Thank you, Mr. Chair and Council. I'm Jackie Ward, and I'm Interim Administrator for Employment and Family Services. And I have prepared a very brief PowerPoint. Walk through it very quickly, hopefully. And it says Division of Employment and Family Services on the front. The section in the budget book is section 324 through 327 and appendix 18, A18 through A20. Maybe this needs to be higher. Is that better? So we'll be working from section 324 through 327 in the budget book and appendix 18, A18 and A20 through A20. So Employment and Family Services is responsible for really administration of program eligibility for 4 broad program areas. We have cash assistance, also known as Ohio Works First, and there's something called PRC in there. And then child care assistance, food assistance, and Medicaid. The benefit households served as of this month's count include 11,516 assistance groups, so that would be families, on cash assistance, 15,765 child care assistance groups, 134,678 food assistance groups, and then 195,000 receiving Medicaid in our county.
I'd like to stop you for just a moment and just make everybody aware how low that 11,516 number is on the Ohio Works First. I mean, there was a point when we started on welfare reform where it was like 100,000 or more. I mean, it has just come down just a huge amount because of the eligibility requirements and people running out of time on time limits and such things. So it's a very low number. Please continue.
All right, our funding sources for 2012, total funding $77,163,000. 82.7% is federal and state funding, and 17.3% is Health and Human Services levy funding compared to 2013, where there's a slight decrease. And Director Warner talked about the purchase of the service credit for the early retirement program, and that is the reason for the drop in the numbers from 2012 to 2013. Next, we have our expenses for 2012 and 2013. outlined in the various categories. And then finally, just a quick review. Our challenges for the coming year include completing the merger of Employment and Family Services and Child Support Enforcement. And mostly that will be in the back room behind the direct service areas, so supportive services such as information technology, kind of linking back to the ISC, also our budget area and our office kind of service area, and things like record imaging and scanning and backroom kinds of services, training, and staff development. So those are things that we'll be looking at. We have the structure in place. Now we're looking at more ways we can sort of leverage that combination of staffing. Another challenge will be to continue to keep adequate staffing to comply with state and federal mandates and deliver quality customer service. One of the challenges is always to keep up with attrition, caseload growth, and to get additional frontline staff on board and trained. Takes at least 12 weeks just in the orientation session itself to get the baseline on the rules, and then some on-the-job training. And many people take up to 9 months to really be prepared to work within the benefit program areas. We're also looking at revising service delivery models to leverage automation. We have an opportunity through a state automation change where we can receive applications online. And very recently, there's been functionality added so that almost the whole interview can be entered by the applicant into the system, and it can be carried over through something called an e-gateway into our very ancient mainframe eligibility system. But it will save us some time, and we think actually provide some more accurate information, because if somebody's entering their own address, they're more likely to enter that correctly. Also with this new automation, we have a feature called benefit lookup. We spend a lot of time on the phone with people telling them what's happening in their case. People are looking for results. They want to know if they've been approved or denied. They frequently need some kind of income verification. So all of that will eventually be available to them once they sign up for an account. So we'll be working with people to develop their skills in their understanding and how to use the system. And then we're implementing a new child care eligibility automated system. It's actually separate from the other program areas, and there is a big change in the payment processing for that system to child care providers. And there's going to be, we're going to be going from this paper voucher system that's very labor intensive to a swipe card. And so there'll be another adjustment to using sort of an EBT card to use child care eligibility services. So that's my overview.
Okay, to recap, Employment and Family Services and Support Enforcement Agency have merged. Jacqueline Ward has just presented on behalf of Employment and Family Services. We're now going to hear from Russ Kay to present on behalf of Support Enforcement Agency, and then we will take questions. Mr. Kay, welcome to the committee.
Thank you. Good morning, Mr. Chair, members of the council. I am Russ Kay. I'm interim director of the Cuyahoga Support Enforcement Agency. And you have a brief PowerPoint presentation before you. And on slide 2, all I want to do is give you just a brief refreshing of the mission of the support agency. We are committed to the best interests of children in our community. We ensure the financial responsibility of parents, support child well-being, and promote healthy relationships. And to take that just a bit further, I thought it might be interesting on slide 3 to just tell you briefly what we have the authority to do and what we don't do. The authority that we have from federal and state statute is to deliver services that relate to maintaining child support orders and records, establishing orders, modifying support orders, terminating said orders when it's appropriate to do so. We enforce orders. We insist also in establishing maternity through genetic testing. We locate absent parents, and we also determine arrearages as well. What we don't do, just as a contrast, is that we do not address custody or visitation issues. We do not dispense legal advice or provide legal representation to any party that's involved in an order determination. On slide 4, this is our 2012-13 budget revenue page. And I'll just walk you down the column briefly here. The first revenue source we list is administrative fee, $3.8 million. Those are the fees that we are allowed to add to a support payment. It's typically 2%. So if the support payment is 100, then the actual charge is 102. The 4D reimbursement, the next line. 4D refers to Title 4D of the Social Security Act, and we're able to be reimbursed for program services by the Federal Office of Child Support at 66%. And so the 18 million represents that federal reimbursement at the 66%. State allocations, $2.4 million. That's from the state for child support program services, which we can use as a local match. That's actually an increase this year. Last year it was about 1.8. It's been increased by about 600,000. The medical incentives are 200,000. This is a small revenue source, but basically it's when a judge in juvenile court instructs or orders the father to pay the birthing costs that have been paid by welfare, we can go in and take the child support payment as part of covering that birthing cost, reimburse the state, and we can keep 15% of that as an incentive. So it's a 15% incentive of birthing costs. And then the levy, I've broken the levy into two parts for you. One for the Child Support Enforcement Agency itself, which is just under $2.4 million. And we have added the Fatherhood Project, so that's about $978,000 of levy funds. That includes $850,000 in contracts, and the remainder is 2 staff personnel. On the budget expenditures, certainly probably 2/3 of the budget is personnel, salaries, and benefits. That's the $19.7 million. Commodities and capital certainly go to office supplies, electricity. Under contracts, which is just a little under $8 million, that includes contracts that we hold with the prosecutor's office, the domestic relations court, juvenile court, and the treasurer's office as well. That's the bulk of that 7.9 figure. The controlled costs, 1.9. That's data processing and space maintenance and other operating. That would include our $2 million subsidy to the Health and Human Services Department. Also postage. Postage is a very high cost to us because by state regulation, many of the actions that we are about to take or do take require a great deal of process, and a lot of letters and such need to be mailed and sent. It is an area, however, where we're looking for some greater efficiencies. And then the last stage slide, a quick review. The largest change in our business practice here is that we are taking the Fatherhood Initiative under the umbrella of the Cuyahoga Support Enforcement Agency. And let me just say, and there may be questions about this later, I'm very pleased to do so. I think the Fatherhood Initiative has been a successful program here in the county as well as statewide. It's been recognized both federally and state for its best practices. And the research we know in child support is that when a father is engaged with their family, with the child, that child tends to do better in school, tends less likely to get in trouble, less likely to be using substances, and the obligor or the father is more likely to take financial responsibility and pay child support. So it all kind of dovetails together. And that's some of the other items there, just very quickly. We're looking for greater efficiencies by reducing office space. You may recall we're actually in 2 locations, Virgil Brown Building and Reserve Square, where we are reducing our footprint, as it were, in the Reserve Square and saving approximately $97,000 a year there in rental or lease. Also looking to improve customer service through various automation projects that we have in place. And then the last statement I should make is that we are really looking to work smarter. What I have listed here on the second bullet point, case management strategies, we're really looking to how do you work smarter? How do you take a caseload and how do you categorize it and develop strategies that best fit the motivations and the willingness and the ability to pay child support? So we're looking to really work smarter, looking at our caseloads. How do you stratify those to optimize the child support payments that we are able to collect? That's the end of my brief presentation. Thank you.
Okay. Director Warner, is Mr. Grimes going to make any separate presentation on fatherhood? No, sure. Okay. Questions by my colleagues? Councilman Gallagher, and who else do we have? Okay.
Mr. Kay, are there men that have had children? I'm not going to actually go to the father part of it. Men that have had children that have not paid, that are in this fatherhood project initiative, that have not paid birthing costs? Do we?
I don't know. We can certainly
I would
determine
definitely
that for
want to
you.
know that
All
because that seems to go counter to the fatherhood initiative. I think you need to earn your stripes to get into that.
All right.
And how do you go about that? Go through that again for me. Who goes after that? The state goes after that, or do you have someone that goes after the birthing costs?
I think the best answer may be our fiscal officer, Rick Weiler. So my line.
Good morning. Basically, it's all by court order. We, for the most part, juvenile court order determines the amount of maternity at the time of the initial order to reimburse welfare. The mother was on welfare at the time the child was born, and these were costs that were incurred through medical, through the welfare system. And the court orders $50 child support, $10 towards medical, so the order is $60 a week, for instance. And as that money comes in, it goes to the state to reimburse the state.
And and I should know this, but I don't, the juvenile court has its own clerk?
Yes. It has its own clerk.
And can we get the statistics on where they're at in these collections?
Well, the collections would probably be, we could run some programs that would determine how many dollars are out there to be collected, and then how many of them we have collected on, but that would be for us.
That'd be very helpful, and that would go to telling me if a certain program is worth the money that we're putting into it.
Well, fatherhood really would have nothing to do with that.
Well, my point is to
se.
get into fatherhood, you should at least take the responsibility of being a father and pay for your child. and
Okay.
minimally pay for the birth of your child, and that goes directly to the court costs of the $10 going back to the state to be reimbursed back to the
Well,
state.
At the time that it goes to court, the court may not order birthing cost reimbursement. So it's up to the court to determine whether or not the birthing costs and whether or not the prosecutor brings that forth as an element to be reimbursed. So the person who may be going through fatherhood may not have to pay birthing costs. It just depends on each individual case and what the court orders.
Okay, I think that's a question for the prosecutor, not you.
Okay.
Yeah, so, thank you.
Councilman Rogers.
I have two. Well, one, just a point on the fatherhood program. You know, I've participated in a program of the Fatherhood Initiative with the boot camp for dads, and I found it very helpful. And I'm just saying that, you know, not everyone that's making use of the fatherhood program has any type of problems with paying child support. It's a program that's open for fathers to kind of provide training and how to engage best with your child. So, but I had a question actually for on the Employment and Family Services, and just on your numbers, the benefit household served.
Yes?
The cash assistance Ohio Works First program, you have 11,516 people. Are there duplicates with these other numbers here? So if I'm on cash assistance, do I automatically qualify for food assistance or any of these other programs?
Yes, Councilman, through the chair, there's an overlap, and we have 189,000 separate benefit households. So you can see that there are these assistance groups can overlap. Out of the cash assistance household group, about half, or well, about 5,000 also have food assistance and Medicaid. And then there's a half who are receiving cash assistance and Medicaid, but probably not food assistance unless the entire household is eligible, because those are the child-only cases
Gotcha.
living with relatives.
Okay. Thank you.
Thank you. Couple questions. First, with regard to the budget revenue page, which indicates a 4D reimbursement of 66% as a revenue source, but on the pie chart, it indicates 57%. There's a differential between the 66% federal the reimbursement in the pie chart. Is that?
Mr. Chair, to the council member, the 66% is the federal participation rate for any of the reimbursable expenses for child support program services. In the pie chart, the 57% would be, it's a different percent. It's what percent that line is of the total revenue.
Mr. Chair, to the director, so we're not using all of what's available? If there's eligibility for 66% reimbursement for programs, am I not?
Well, not all program services or all expenses are reimbursed at 66%. Program income, for instance, which are the assessment, administrative or assessment fees, are not reimbursable. So it's only certain personnel, for instance, space costs, supplies, those are the costs that are reimbursable at 66%. So the 57% is really recognizing that not all of your expenses are eligible for that 66% reimbursement.
Okay.
I think perhaps another way to say that, and Russ did, but just say it a little differently. Certain revenues that the child support agency receives must first be expensed before seeking the 2/3 federal reimbursement.
Okay.
Else, Ms. Simon?
Questions, medical incentives, the revenue that my colleague asked about with regard to birthing cost reimbursement by the fathers. In addition to that, is there any indication where the cash medical will be received? Is that the line where the revenue would be received for the cash medical reimbursement?
No, the cash medical, if I may, Mr. Chair, to the council member, cash medical is let me define it for everyone. Cash medical is the recognition that a child also requires, beyond the financial child support payment, requires medical support as well. And back a few years ago, about 2008 or so, it was determined by the Federal Office of Child Support that not only would a CISA, a child support agency, determine orders of child support or financial support, but also would determine or ensure that a child had medical support as well, medical insurance support. And so a support officer or a hearing officer would determine that the parent or one of the parents or both parents had insurance and would ensure that that child was on that insurance policy. If there was no insurance, then the obligor, the father typically, would pay an additional amount of child support called cash medical, a few more dollars each month, in addition to the financial obligation to cover the medical needs of that child. Again, when no one had insurance available or was not readily accessible or readily that they could readily pay for it. That cash medical is part of the would be part of the 4D reimbursement. Right. Maybe a lifeline, I guess.
The cash medical is simply a part of the child support order. It has nothing to do with the revenue. The child support, it'd be part of the child support collections that we get on an annual basis of $240 million.
Mr. Chair, to the Director, the cash medical, in theory, is supposed to reimburse the state for monies expended for health care for uninsured children. So if this money's it should be part of a child support order, it should be allocated for reimbursement for those expenses, just like a birthing expense.
That's only if the person is on welfare, is getting welfare. Then the whole, whatever child support's collected goes back to welfare. They assign those dollars back there. But it's also for individuals who are not on welfare to help them pay for health insurance costs.
I understand, but just like the birthing expenses, some of those birthing expenses are covered by the mother herself, and some are reimbursed for welfare expenses. So that money comes in under a line. I'm just wondering, for the welfare reimbursement, where would that show up on here? That's all I'm asking. If it's not going directly back to the mother, but it's reimbursable to the state.
Well, that's part of our $240 million collections. And a portion of that collections is going back to the state. $10 million a year is going back to the state.
I'm just asking because medical was sorted out here as a line item, and I just wondered why this other medical reimbursement wasn't. Health insurance costs were not.
Well, that's part of the child support collections, and it doesn't bring us any revenue. The $240 million that we collect, we don't get any. We get 2% fee on that, but that's it. That's not a revenue to us. That goes directly to either welfare or out to the woman to take care of the child.
Who does that? Who pays that? Who sorts through that and actually reimburses and cuts the checks? Who actually is doing that?
Okay. each child support case has a child support order. So much for child support, maybe so much for cash medical, okay? The man or woman is ordered to make a payment, and we have about 75% of people are wage deductions. The money comes in, it goes down to the state, and the state then disperses that under federal law to the payee, custodial parent.
And just two more questions, Mr. Chair, if I may. In terms of the Fatherhood Initiative staff, you said there's 2 staff people?
Mr. Chair, council member, yes, 2.
And who is a director and an assistant?
Yes, program manager and an assistant, yes.
And where are they physically located?
In the Virgil Brown building, in the support enforcement agency floor.
Okay. And the controlled services then would reflect that move in consolidation of the CISA departments, some of which moved to juvenile court and some now consolidated in that building. So is that correct?
Well, we consolidated in the Reserve Square building, moving out of one floor to what we call the Galleria. That's saving the $97,000, and that would be under contracts and professional services as a lease agreement with Reserve Square.
Okay, Councilwoman Conwell.
To the chair, to Director Kay, just to follow up on Sunny's point, so do they have 2 separate offices for the fatherhood program? The 2 staff?
It's really one office that has a kind of an assistance area, secretarial kind of clerical area, plus the larger office for the program manager. So it's one office, yes.
Okay, so is it in a high-traffic area for the fathers to be able to know where it is and all that good stuff?
What we did is that it is in it's right off the front desk area. It's in a high-traffic corridor. You go right down, it's right there to the left. It's a fairly large office. And we decided to put them there, put the program there for it. We wanted its visibility. We wanted to give it presence. We didn't want to bury it on a floor somewhere. We wanted to have presence. So yes, it's easily accessible to any fathers or visitors that would come to that program.
And there's a staff that maintains that all the time, that is
Yes.
actually at the site?
Yes.
My other questions are more geared to the CISA. You spoke of new initiatives. What new initiatives do you have planned right now to actually collect the child support to reach the 66% goal that you want to reach this year?
Mr. Chair, to the council member, I think one of the primary initiatives we're looking at is, as I mentioned a little earlier, is looking at the caseloads, and rather than really having a one-size-fits-all strategy to caseloads, begin to categorize cases or obligors according to their willingness to pay or their motivation, as well as their ability to pay. And then dividing those caseloads or obligors into cohorts of sorts and developing strategies that are specific to maximizing the fulfillment of the financial obligations. We're also looking to develop a strategy where we begin to look at new cases more readily. I think it's very important that within the first few months or first year that we engage fathers or obligors, that that we're there to explain in plain English what the responsibility is. So we think that rather than taking sort of a new case and sort of throwing into a caseload of cases of various maturities, we need to focus on that. So we're looking to develop a special team of staff that will focus on cases that are less than 1 year of old. And then other cases that are over a year old begin to stratify or categorize them again into willingness and ability to pay, and developing strategies specific to those cohorts of cases.
And that was one of my other questions, what efforts are being made to currently work on the new cases or prevent cases? So the preventive cases, you have some sort of outreach or something like that?
Yes. There is an outreach group already in place, but with this case stratification, it is to make greater contact, more frequent contact with obligors. Here, automation can be helpful as well. There's one area where we currently remind parties that have an appointment with a hearing officer. We have an automated phone system that day before will call and remind them of their appointment with the county on the next day. And we're tracking whether or not that's going to improve the show rate. We're looking to expand that to those who might be a little behind in their payments, also reminding them through calls, either live calls with some of our legal service assistants, or again through an automated reminder system. So I think a combination of a number of strategies, how we work cases, how we employ automation, all that's going to help us work smarter and begin to improve that percent that you're looking at. Because that percent, currently, in terms of collections, of current support collections, we're about 60% of what is charged is what we collect. And in comparison to other counties, that's number 88. That's 88th. We need to move that needle. We need to get better. We need to work smarter. Benchmark, that 65 is really a benchmark. Franklin County is about 66.5%. The other metro counties together are at about 64.5%. So that's the benchmark we're reaching for, and we need to work smarter to get there. And we'll use a number of pilot studies, incremental kinds of improvements to move that needle.
Through the chair to the director, so that was one of my other questions, about how many caseloads are assigned to each officer?
To a case-loaded support officer, they're in enforcement right now, they're at 1,500. 1,500 for an enforcement support officer. In comparison, because we've done our comparison work as well, the Franklin County is around 800 or 900.
Through the chair to the director, so what barriers are being eliminated for parents to pay child support? Because I have a sort of a disagreement with, they hold up their driver's license and things of that nature, and then it's hard for them to get a job, and so then we're just back in a circle. So what are you guys looking at to reduce those barriers for these parents to actually get a job and pay their child support?
Mr. Chair, to the council member, I think there's several strategies here. First, there's a new state law, sentencing law, that did include a change in language about the suspension of driver's licenses. So there's more flexibility now. That actually, in the past, we were able to begin suspension proceedings, if we wish to, when someone was in arrears at only 30 days. But now we have to go back 3 months, and if they've been paying child support at 50%, then we would not suspend. So there's some state laws that are beginning to lessen the impact of, lessen the number of suspensions and the impact of those suspensions. But I think what is also going to help people just understand, I think part of paying child support is understanding as well what the expectations are. And for instance, when we did a driver's license amnesty program this last August, we had over 500 people who got their licenses back. We just said come in, pay a month of child support plus $50 toward the arrears, and we'll give the license back. That was a lessening of some of the typical requirements to get a reinstated license. But part of getting the reinstatement was that you had to sit in a class for 20 or 30 minutes, that's all, and learn more about what the expectations are. Because although we're quite willing to lift people up and help, there's still the expectation that the obligation will be fulfilled. But I think it's on us also to explain in plain language at times what the expectation is and what the regulations may be. Having the fatherhood program join us brings further resources and capabilities. In a sense, it puts into our toolbox more tools, more programs, more help to lift up fathers, and in this case, who may be involved with child support. And a good point was made earlier by the council member that fatherhood serves all fathers throughout the county. It's not just child support paying fathers. But I tend to put that hat on, so I was trying to a little focused there. But I think the Fatherhood Initiative, having a part of child support, brings those additional resources. It allows us to be even more toward helping people find jobs, if they need job training or further education. It just improves our ability to help the whole person rather than just looking at somebody as someone paying or not paying child support. It's a whole person there.
For the, through the chair to the director, and I don't know if the fatherhood program does this, but maybe in what you just stated, they could work with those fathers with financial literacy, with a budget of actually paying their, you know, how they would sit down and focus on the budget, because some people, you know, are not, have a mindset for the budget. So to help them and guide them to know that they need to pay that assistance. And you stated that the amnesty program, that they only came in for a month. Was there some kind of incentive to continue to pay their child support?
Well, the intent of the amnesty program was to offer relaxed requirements to have it reinstated. And we actually had over about 6 months. I'm sorry, not 6 weeks. I actually extended it another week so that the time period would be would end a few days after the Fatherhood Conference. So I wanted people to hear about it at the Fatherhood Conference that took place last September, and still have a few days to take advantage of the amnesty program if they wanted to.
2 more questions.
Please proceed.
Through the chair to the director. I'm just trying to get this clear. Is the procedure different in obtaining child support from a father that baby's mother is on assistance versus a mother that isn't on assistance?
For the father, no. For the obligor, no. What happens is that if the mother obligee is on public assistance, cash assistance, we continue to collect the child support. But the child support is basically goes to the state to defray the state's cost of the cash assistance. So you can't have both the cash assistance and the child support.
I get that.
Right.
What I get is that it just seems like there's more attack on getting the assistance from the father that mother is on assistance versus the, you know, from the other father that, you know, the mother might not be on assistance. Are we focused in on them? Because those are people that are actually working that are not paying their assistance. It seems like we're putting and we should, putting more focus on that versus on the whole, collecting from the fathers that mothers aren't on assistance, that, you know, the state isn't demanding for us to reimburse.
Mr. Chair, council member, I don't believe we really focus on one group versus the other. We're enforcing vigorously the financial obligations of a child support order, I don't think we're differentiating the recipient of a cash assistance versus not, but vigorously enforcing the order for whomever it may relate to.
Mr. Gautner?
You know, one differentiation that may be evident, individuals where the payer of child support is a low-income individual themselves and not on earning a regular paycheck is less likely to be making their support payments through wage withholding. So individuals who do not have a regular job, are not making payments on wage withholding, maybe they work, maybe they get paid cash, maybe they work episodically, maybe they're independently employed. Those individuals not on wage withholding are more, and not paying, are more likely to come up in some of these special techniques like driver's license enforcement.
One final question through the chair to the director. On page 3-14, at the bottom, you had workplace improvements. What have been some of the workplace improvements suggested through the employee surveys that you guys conducted?
Mr. Chair, council member, yeah, on the workplace improvements, about a year ago, just a little background. About a year ago, the agency brought in an independent outside consultant to do a survey of all staff, including a few interviews of staff, to get a sense of the workplace environment, both the physical environment, the psychological, the work stress environment, as well as the openness and transparency and trust for management as well. That survey was completed some time ago. From there, some staff, what we call work groups or focus groups, were developed to oversee the gradual completion of an action plan. And what we did do as management is we met quarterly with each of those groups. One group on transparency, another on communication, physical environment, and so forth. And we went through what have we accomplished, what have we not. And for instance, on the physical environment, there were concerns about a schedule for cleaning carpets. Well, we got that schedule in place. There was issues of cleanliness of men's rooms and women's rooms. We had that taken care of. We got paper towels in the restrooms. That was a very important accomplishment. But others were having an iBox, what we call an iBox, or a automated suggestion box that's on our interweb that we committed as management to respond to any suggestion within 10 days, and we have done so. There were what we just put into place was an employee recognition program. It's essentially staff to staff or peer to peer recognition. So there have been a number of physical environmental changes that we've met. There were a few that we did not, and we simply were quite open and honest and said there's some things, like some training was beyond the budget at this point, but we recognize the needs. I can get for you, if you'd like, a list of what that action plan was, and as of a couple of months ago, what the status of each of those items were in terms of being completed, in process, or not feasible at this time. And that's what we shared with the entire staff. It's on our interweb, if you'd like to see that.
So, yeah, because
Okay.
I see that you say to include a plan for follow-up survey again.
Yes.
So that is it should be an ongoing thing.
We met with the same consultant about 2 or 3 weeks ago. We focused on changing the survey to make it a more concise, more focused, more as a follow-up. She's going to analyze it and provide us, again, with sort of an interpretation of the results and a new action plan. And this time, rather than 4 staff focus groups focused on different areas of improvement, one steering committee of staff and some supervisors, some of whom have already been chosen, that'll go forward with this consultant over the next year on this new action plan. So it's very important when you're doing a survey of workplace improvement to commit to a follow-through and do a follow-up with an independent eye that tells you what you've done well and what perhaps you still need to do.
Okay, could you send us the progress report on the action plan? Send it to Trevor McAleer, our budget person.
Mr. Chair, yes.
We would like to see that. Anything further? Ms. Simon.
Very quickly, thank you. For, how much would we need to pay additional caseworkers? 1,500 caseload per worker. I'd like to see that number go down. What's the cost to hire a couple more caseworkers?
Well, the typical cost that's used in that kind of analysis is salary and benefits is around $55,000. But let me say that with some of the techniques that we've been talking about, strategies for working smarter, that we're prepared to go through this next year with the executive's budget as presented to council.
The mothers who call to get service have to wait a long time to get a call back often, and they're going through some struggles to get paid. So when we're looking at budgets, I want to make sure that both ends are covered and that the people waiting to get their paid have service, because 1,500 results in a long time wait for the obligees. And secondly, I understand that, I just want to clarify this, that some of the money, and I'm not picking on the Fatherhood Initiative, I just want to understand why the mediation department is paid, I think, $40,000 out of the Fatherhood Initiative budget. First, is that correct? And secondly, I still don't understand why that's happening like that. Instead of paying the Justice of the Mediation Department directly, the money flows through Fatherhood, through CISA, or this department, and then back over to Justice Affairs. It's a roundabout way to just pay a mediation department.
Mr. Chair, council member, the Office of Mediation is one of the funded contracts of the Fatherhood Initiative. And as you probably know, the Office of Mediation is currently in the Public Safety and Justice Services Department, what was Justice Affairs at one time. It's now the division itself of Office of Mediation is located at, I believe, at the new Juvenile Court office. We provide space for a staff member of that office in CISA, in the Virgil Brown building. We provide that at no charge. The Fatherhood pays the personnel costs, which are about $40,000 for that position. We find that from CISA's point of view, that's valuable to have that person there, because when someone is actually there, it's...
I'm sorry, Mr. Chair, I'm not asking a rationale why you have it. I'm asking why that money's not paid directly to the Office of Mediation. That was my question, if I may. I mean, I understand the rationale.
Yeah.
I've asked and it's been answered, but I just don't understand the roundabout payment structure. And I don't need an answer this minute because we're running short on time, but I still have not really been given an answer.
Mr. Chairman, it's my understanding that the project is chosen on a competitive basis as a result of responding to the request for proposals issued by the Fatherhood Program. And so it's not an automatic ongoing project. It is in fact ranked among the other services to be made available to fathers, and that is, the basis of the decisions made thus far.
Okay. I have one question for EFS. Ms. Ward, your department submitted a budget decision item to replace 20 EFS specialist positions at a cost of just under $1 million a year, and which was not included in the budget proposal. What I'm asking is what conditions are you experiencing out in the field in terms of the ability to provide services that motivated you to make that request?
Our current worker to caseload ratio is getting close to, between 550 and 600 per individual caseworker. We have some specializations and things that we're doing. We have a very standard approach to the work. But in just looking at other jurisdictions, counties that had higher caseloads were less likely to meet their mandates and had less responsiveness to clients in terms of turnaround. One of our chief goals is to provide a decision within 30 days of receiving an application. And that gets delayed sometimes, especially for Medicaid, because there's other outside factors that influence that. But at the time that we were looking at our staffing and our caseload level, we thought that would be the number that we needed in order to reach a more closer to 525 caseload. But we are prepared. We have been working on other strategies. We're prepared to move forward with the budget we have, and we are thankful that we have the funding level that we have for 2012.
Thank you very much. Anything else? Okay, thank you very much. It is now time for our, yes, Mr. Gautner.
Chairman, if I could make one very brief comment. While certainly the resources devoted to this one agency are significant, $100 million totally state and local funds, I think it would also be important to the Council for the Community to be aware that the economic impact of services and benefits provided to the community through these two, now one agency, exceed $2.5 billion a year and support tens of thousands of jobs in our county, in healthcare, in the food industry, early childhood, and in other spillover aspects of the economy. Thank you.
Okay, we are ready for our lunch break. And I think everybody looks ready. And so we're going to stand in recess until we're not going to get the full hour. We're running behind schedule. We're going to come back at 1 o'clock.